You're always teaching me something here. All right, the new word, the new hot buzzword is AlloClae.
AlloClae.
What in the world is it?
So AlloClae is essentially body filler. It's fat, but it's body filler.
Body filler.
Yeah.
Okay. I guess I first have to ask, what are we filling?
Yeah, so we like to use it primarily so you can fill the rear end.
Okay.
You can fill hip dips or the lateral hips. You can fill some of the breast tissue to enhance. You can also fill contour irregularities from previous liposuction.
Where's the filler coming from? Is it coming from you or?
Good question. So it is human derived, which
Okay.
means it's from a cadaver. It is ethically harvested
Okay.
and then utilized. It is processed. There's no living cells or DNA contained in it.
Okay, good to know.
But essentially it is purified fat, and they call it ECM, extracellular matrix.
So don't be fearful of it. Is
Don't
it
be
like
fearful.
when someone donates an organ?
Yep, we use donated parts all the time for knee surgeries, for retinas, for all type of corneal lenses. It is a part of medicine. It's been a part of medicine for 50 years. The company that provides this product has been in that business for over 50 years.
So what were we doing before? I know this is new.
Yep. So traditionally we have to harvest the fat, right? And so if you want to, so fat transfers are very large in plastic surgery, but usually the man or the woman has to have enough fat in an area to take it. So it has to be liposuctioned and harvested. It's then processed and re-injected. So for example, you've heard the word, we've talked about BBLs in the past,
Yes,
right?
yeah.
Right? So BBLs were big with Kim Kardashian, right? So we would
Yeah.
harvest fat from the abdomen midsection. We would take that fat and then we put it back into the rear end to fill the rear end, okay? And so this product is eliminating the harvesting, right? So one, it's eliminating the liposuction procedures. And then two, there's a segment of patients, you're a very thin lady, and ladies that are thin is in and thin is healthy.
Thank you.
That
I work
don't-
hard at it.
Well, they do, that don't have enough fat, right?
Yeah.
So fat is good. I always tell patients, a young woman has fat, but the fat's in the right place. It's in a young woman's cheeks, lips, breast, and butt. Part of the aging process is it goes from the face, the cheeks and the lips, to the neck,
Yeah.
the breasts to the belly, and the butt to the thighs, right? So fat is good in a female at certain areas or levels. And so what happens is, a lot of ladies say, hey, my butt is just falling, right?
Yeah,
Or it's just,
yeah.
it's going away because you get penalized for being thin as you get older.
Right.
And it's people come in and they, hey, I used to have a nice full butt, but I work out every day, I work hard, and my butt is no longer there. So it's a great option for ladies that don't have fat.
So in essence, it's less invasive then, right? You're
It is.
not having, if you don't have it, there's nowhere to take it from,
Correct.
and you don't
Correct.
have to do the lipos. So this is just,
It's easier, it's simpler, it's quicker. What is the downfall?
risks.
Well, the risks are no more, they're actually less than using your own fat.
Okay.
The risks are similar with any other body filler or facial filler. Infections, and you can injure the skin. But the other thing I tell ladies is you have to pay for it, right? Your own fat is free.
True. I didn't think about that, but you're right. Yeah.
It's much more economical than using facial fillers for the body. But it's not free, right? And so there's a price associated with it. But the amount that you get for the price that you pay is really very good. I've used it on my own family members. I'm not going to say who, but it's very, very safe.
Yeah.
It is ethically derived, and it really is the future of plastic surgery.
What can one expect who's having this procedure? Everybody wants to know about downtime and recovery. Talk me through that.
So just like any other filler procedure, you walk in the door, we mark you where you want it. We do numb that area,
Okay.
which is a little bit different. We do make a single little small incision, so it involves one stitch. We then put the cannula and inject the filler in the area that you want it.
Okay.
We put one little stitch to close that little incision. And beyond that, you walk out the door. Until the stitch comes out, you can't immerse yourself in water.
Right.
So no hot tubs, bathtubs, or pools. But you can shower, you can clean yourself, you can resume normal activity the next day. So downtime is really none.
Minimal. Yeah.
Really none.
Yeah.
As long as you're okay with not taking a tub bath for a week, you're right back to it. Yeah.
And then finally, results, the length
Yeah.
of those results? Do we have a longer time using this?
Yeah, so I can't say forever.
Yeah.
The company hasn't,
Nothing's forever.
nothing. Some people don't know that, no, but you'd be surprised. So it's not forever. Is it a long time? Yes. Many, many years, I tell patients.
We'll take it.
Yeah, think of it like this, is that it's almost like a scaffolding that we're inserted in there. And it's one for one. So what you see is what you get. And then over the next couple of years, your body sort of replaces that fat scaffolding with its own natural fat. And so we do think that you're replacing the scaffolding with your own natural fat. We don't have, obviously, this is a newer product, we don't have 10-year studies. We know it's safe.
Yeah.
We know the longevity is really good. Can I sit here and say, oh, it lasts for 15 years? No. But it's well worth it. It's the best product for body filler out there right now.
Once again, something new.
It's crazy. Yeah, I mean, what a world we live in.
What a world.
We've sat here and talked about all types of topics, but AlloClae to me is one of the most radical, sort of just like, wow, being able to take fat from another source and put it into your body. It's just, the world of medicine these days is amazing.
Well, I always enjoy hearing about it. Thanks,
Thank
Dr.
you.
Weiler.
Thank you.